Delivering your DENTCA dentures. When a trial denture appointment is completed, most of the necessary adjustments are completed or communicated to the lab at this visit. As such, minimal adjustments are typically needed at the final seat date, since the final denture duplicates the trial denture and any changes that are made. If you skipped the trial denture visit and went straight to the final, some adjustments may need to be made. Typically, we'll find that single dentures opposing natural teeth require more adjustments than full over full, as we will find that we're not working against an ideal occlusal plane. We will now review some of the most common adjustments needed at that trial denture visit. As with traditional dentures, it is best to evaluate each denture individually and then evaluate them together. Here we will start with the upper denture. The upper denture is seated, and then the fit and retention are evaluated. If the retention is poor, it could be due to several factors. Most commonly, these are 1. High spots that are either preventing the denture from fully seating or causing the denture to loosen as they impinge on the soft tissue movements, or 2. An incorrect post-stem. The post-stem could be too tall, impinging on the tissue and preventing a seal, or it may have been missed altogether in your impression. The best way to determine which is causing your retention issue is to evaluate with pressure indicating paste. When you utilize pressure indicating paste, it's easy to see the high spots if you apply it in such a way that the brush strokes are visible. Carefully but fully seat the denture, then have the patient move around to activate their muscles. This includes both the muscles of mastication and the muscles of facial expression. In this case, there was one high spot in the anterior area that was compromising the seal. Later, this would also likely cause a sore spot. This high spot should be adjusted with a slow-speed handpiece and an acrylic burr. Reapply paste in that area with the brushstrokes visible and repeat the process until no high spots are revealed. If the post-stem were too tall, that would be rubbing away all the pressure indicating paste in the post-stem area. Very slightly adjust until the retention is obtained. If the post-stem still is not engaging, you will see that the denture is seating everywhere except the post-stem. At this point, you will have to take a wash impression inside of your denture and send it back to DENTCA to be rescanned and refabricated. Repeat the process with the lower denture, relieving any high spots or undercuts that would prevent a full seat. Because the DENTCA trays are designed to capture such accurate detail, often the mandibular dentures are overextended in the retromolar area, resulting in very tall retromolar areas in the posterior. These tall heels can result in occlusal interference, as well as dislodging the lower denture when the patient starts functional movements. Shorten these areas from the top down and round off until the patient feels comfortable in the posterior area and they can move freely without interference. Finally, we evaluate the bite. Make sure both dentures are fully seated. I like to use 2 pieces of articulating paper, one on the left and one on the right of the same thickness. Otherwise, patients will tend to bite towards the side that you place the paper. Here, the bite is very close, but the patient notes that they first contact on the first molar area. That contact is adjusted, so we now have even posterior contact across all teeth on both sides. The dentures are cleaned and are now ready for final patient delivery. Your final seat is now complete. Follow up with your patient as needed. It is recommended for complete denture patients to visit the dentist at least once a year to evaluate both denture fit as well as soft tissue health.